Hello everyone, thanks very much for coming. We're very excited about this inaugural version of a program for the Center for Dynamic Health here at Johns Hopkins University. I'd like to recognize all the other people who've contributed to this. It's been a collaborative effort from several different departments to come up with all the speakers and the ideas and doing all the work. And particularly want to thank Dr. Schaefer for taking the leadership and Dr. Fickey for providing the support of the department. I have to apologize for why I'm not here today. My daughter is a level 10 gymnast of level 10 in USA gymnastics, and so she has a regional meet today, and I'll be there. So if she does well, she goes on to nationals, so wish her luck, and I again apologize for not being there in person. So I guess the first question is, what exactly is the Center for Dynamic Health? I have to admit that it's now a virtual concept in that we've been thinking about this for a long time. Primarily the idea is to create a center to promote research studying the role of exercise in prevention in disease and also in treating disease. Our goals here today, though, are primarily to promote a yearly conference as sort of a start and to create some enthusiasm at Hopkins for disease prevention through exercise. And also today to have several different speakers report on the effect of exercise upon any number of disease states. So I think we have a very exciting program with some very important speakers talking about a variety of programs, not only here, but regionally as well. Also, one of the goals is to hopefully stimulate some collaboration among researchers across departments and disciplines here at Hopkins to produce or promote translational research from bench to bench press, so to speak, and also to encourage philanthropy to provide funding for the center and to try to get people to help us fund this endeavor in terms of its longevity, but also creating larger and bigger projects, which I'll talk about in a bit. So I think as far as sedentary lifestyle and its effect on everybody, we all know the statistics. The sedentary lifestyles over the past 70 years have led to increasing body mass index, an increase in obesity, an increase in what are called inactivity-related diseases. For a long time, it was sort of felt to be a problem in the United States alone, but it's spread through Europe and South America. And this article was in the New York Times just a few weeks ago about an unexpected epidemic in Kenya and across Africa, and that being obesity. So just for everybody, just a little review. The major definitions are, and what we talk about most of the time when it comes to people's weight and their fitness, is the body mass index, which is weights in kilogram over height in meters squared. So a BMI of 25 to 30 is considered overweight. BMI over 30 is obese. Extremely overweight is a BMI of over 40. There's some controversy about its use because some people can be very densely packed and athletic and have a high BMI but be very fit. We know that the BMI has been gradually increasing over time. Here's a graph which is a little bit old in that it stops in 2014, but overweight men and women have stayed about the same, but obesity, you can see the graph, the graphs have gone up significantly over the past 10 to 20 years. Also by country, the United States still leads the rest of the world in BMI as a percentage of the population. And these are projected out to really fairly extreme numbers by the year 2030. Race also can be affected by the obesity rates or related obesity rates, as we know, and a lot of this is important in terms of deciding where to spend our money and where to spend our resources. As we know, this also tends to increase by age. These are comparing France and England and the United States. And you can see, of course, the United States is at the top. And we know that as people get more mature or age, they tend to get increasing BMIs, which can be deleterious to their health. There's lots of inactivity-related diseases. We all know type 2 diabetes and heart disease, some cancers. Almost every disease that you can think of is affected by inactivity. The costs of obesity are huge. Healthcare costs in the United States alone are projected to be about $150 billion a year. There's billions more loss in productivity, and there's untold dollars in terms of human lives and happiness in terms of the effect of obesity on our health. So there are many organizations around the world involved in this, including several here at Hopkins, including the School of Public Health. And all of these are now concentrating or trying to concentrate on solving or at least obviating or preventing these inactivity-related diseases. These are just some examples of articles in the literature in the past few months about the effect of exercise on socioeconomic activities or circumstances, effect of exercise in prostate cancer patients, exercise in all-cause mortality, exercise as it relates to pregnancy and the postpartum period, etc. So just about any topic can be related to exercise and can be affected by obesity. There are lots of diseases affected by exercise. Me as an orthopedic surgeon and some of us in the panel who organized this conference, we see a lot of patients who have fractures that are related to osteoporosis or related to other diseases. And just about anyone in almost any discipline can be related or at least part of this endeavor to look at the effect of exercise on disease. So the real vision is to establish an internationally recognized institute whose goal is to study the effects of exercise on health and disease and to position Johns Hopkins as a leader in this area. Primarily it's to create a viable research program that includes both clinical and basic research, and eventually hopefully we'll be able to discover ways to integrate this with the Hopkins community but also with the local communities to help decrease obesity in the local community. So the idea is to have a Center for Dynamic Health that's made up of individual research centers of excellence. So for example, there would be a Center for Exercise and Bariatrics, for osteoporosis and bone health, for cardiovascular disease. And the idea that these would all be held together by some central administration to help direct the research, but also help to direct, hopefully, funding. There are some small units that now exist at Hopkins with study of exercise. Dr. Stewart and many of the speakers today have different projects going on. One of the goals would be that a patient that's seen in clinic is also given a prescription for exercise. And if they do become part of an exercise program, then the idea would be that they would be part of an ongoing study so that we could integrate the long-term results of the interventions with their disease states. One of the reasons we've sort of pushed the idea of having this funded through philanthropy is that we all know that the NIH money is here today, gone tomorrow. The idea would be to create an institute that's sort of self-sustaining so that researchers wouldn't have to spend so much time writing grants and they could spend time doing their research. So in an ideal world, we could fund each center and name it after a donor, or maybe if we can get lucky and find someone who's interested in funding the whole thing, you get one donor who would put their name on this large project. So right now it's only a yearly conference. I think on a more immediate basis we need to have somebody who can help us with the strategic organization of this plan moving forward. I think it's a huge vision for the future, and it's something that can not only help patients but help not only the local community but also preferably and hopefully not only in the United States but worldwide. So I think many things are possible if you believe that they can be done. 90% of life is just showing up. Thanks so much for coming today, and enjoy the day, and hopefully that you learn something today and become motivated to help us in this endeavor to try to create a Center for Dynamic Health. Thanks very much.